Hi, everyone. My name is Emily LaChance, and I am a student at the University of New England in the Applied Nutrition and Dietetics program. In this presentation, I will be discussing my research prospectus and the effects of probiotic supplements versus fermented foods and beverages on gut health among adults with type 2 diabetes. Type 2 diabetes is a metabolic disorder known as insulin resistance and is characterized by elevated fasting blood glucose and hemoglobin A1C, along with additional factors that contribute to the increased risk of heart disease or stroke. Despite the latest effort, cases continue to rise with over 400 million individuals diagnosed with diabetes worldwide. It has continued to generate a significant challenge for healthcare professionals and health systems. We're beginning to see these chronic diseases develop in younger populations, which indicates a need for more opportunities and methods for prevention and treatment. Recent literature has begun to analyze the interplay between gut microbiota and the development of type 2 diabetes. Several studies have noted that a diagnosis of type 2 diabetes is often associated with profound dysbiosis or an imbalance of gut microflora. When the composition of gut microbiota is altered, it can increase the susceptibility to elevated risk factors and related metabolic diseases. Results of these studies have allowed researchers to determine that the balance of gut microbiota are highly regulated by medications and diet. The same literature has stated that firmicutes and bacteroidetes are two dominant phylum of bacteria that exist in the human gut and have the largest influence on the risk and development of disease. Low levels of these two bacteria have been linked with diabetes through disturbed glucose homeostasis, an increase in adipose tissue, and chronic inflammation. The findings regarding the relationship between the composition of gut microbiota and type 2 diabetes have influenced researchers to examine the effects of both probiotic supplements and fermented foods that naturally contain probiotics and the influence they may have over the composition of gut microbiota and their ability to regulate any imbalance that may be contributing to an illness or disease. The driving factor behind this research was due to the fact that medications and diet both highly control the human gut. Probiotics are microorganisms that provide a variety of health benefits, including the ability to maintain homeostasis among the gut microbiomes. Fermented foods that contain large amounts of probiotics naturally include sauerkraut, kimchi, kombucha, and yogurt, and have all been shown to produce similar results towards positively impacting the human gut. The research question we will be looking at is, does the consumption of fermented foods and beverages result in a healthier balance of gut microbiota compared to probiotic supplements in adults over the age of 30 with a diagnosis of type 2 diabetes within a 6-month time frame? Several randomized controlled trials have found that probiotics that contain the strains of bacteria, such as lactic acid or lactobacillus, are most influential over gut health and disease, and result in greater improvements in symptoms and laboratory results. A study by Razumpush and colleagues assessed the effectiveness of probiotics on glycemic control and lipid profiles among patients with type 2 diabetes. Results showed favorable effects in reducing fasting blood glucose and increasing HDL levels. Kasayan and colleagues also completed a randomized controlled trial among patients who suffered from metabolic syndrome, including obesity, hyperlipidemia, glucose intolerance, and hypertension. Fasting blood glucose, hemoglobin A1C, and blood glucose levels were all monitored through the study and were all shown to have improvements. Randomized controlled trials have also reported similar findings towards the improved balance of gut bacteria and metabolic syndrome among individuals who consume fermented foods and beverages regularly. Fermented foods naturally contain the same strains of bacteria responsible for the results seen in the probiotic groups. While studies have examined the influence of probiotics and fermented foods separately, there is a gap in research in comparing these two variables together to observe the most effective and feasible outcome. The participants necessary to provide significant results to this experimental randomized control trial was found to be 80 subjects, which also accounts for a 20% dropout rate. Participants must be over the age of 30, have a diagnosis of type 2 diabetes, and elevated metabolic labs, including fasting blood glucose, hemoglobin A1C, and C-reactive protein, which indicates the level of inflammation. Participants will be recruited from various health facilities and providers, such as endocrinologists, gastroenterologists, and primary care physicians. The participants that meet the inclusion criteria will be randomly assigned to one of three groups, either a probiotic group, placebo group, or fermented diet group. Each group will be given a detailed set of instructions on how to adhere to their assigned intervention and will be asked to keep a daily record of their supplement or food intake. The data collection will be through one-on-one interviews to ensure accuracy and will also be used to collect a series of data to assess baseline status, such as anthropometric data, metabolic lab testing, in addition to urine and stool samples. I will need written informed consent from all participants, as well as approval from the IRB before conducting the study. It's important to note that not all study participants will receive the same beneficial intervention, that I will practice non-maleficence with the intent not to inflict harm on the study participants, that each participant is participating in this study at their own will, and that continued treatment to whatever intervention was proven to be the most effective will continue to be available after the completion of this study. I anticipate there to be a positive effect on gut microbiota from both probiotic and fermented diet groups. However, I believe the probiotic group will show greater improvements among gut microbiota within a shorter time frame. The results of this study help to potentially identify other natural ways of preventing chronic disease and treating it, but also allows for future research to explore the different avenues that probiotics can have towards health, whether they are consumed through foods, supplementation, or applied directly. Limitations of this study include a higher dropout rate, more than 20%, low adherence, a small sample size, inaccurate recall information, probiotics not working for everyone, in the geographical area. In conclusion, the results of this study will hopefully allow researchers to understand the relationship between gut microflora and chronic disease to be used in clinical practices. Identifying an additional method of prevention or treatment towards a global problem will allow additional populations to utilize methods that work best for them. Thank you.